The Alberta Medical Association is sounding the alarm bells due to a shortage of doctors in the province. Yes, the emergency rooms are filling up with patients with minor ailments due to a lack of family doctors in many areas. Of course, throughout the story, it was implied that the hostile UCP policies have caused doctors to flee the province for other jurisdictions, and we have to spend more money. They use the term invest, of course, but it's spend, and we have to spend it right away if we're going to stop this problem. The lack of doctors is indeed a concern. Healthcare is always the top issue in provincial elections, and it appears that things are getting worse. Is it really because of the UCP, though? So in doing a short search of the term doctor shortage, province by province, news stories in every province sounded exactly the same. Every province in Canada is running low on doctors, in fact, in health professionals in general. If Alberta's UCP is indeed driving medical professionals out of the province, they apparently aren't going to the other provinces. I mean, it is believable that many of them are leaving the country for greener pastures, though. The world market for medical professionals is competitive. Many countries with less restrictive healthcare systems than ours have been actively headhunting for medical professionals here. So, can we pay enough, though, to keep medical professionals from leaving? I mean, labor makes up the majority of healthcare spending, a lion's share of it. Even small salary increases across the board could blow up a healthcare budget. And while there still might be room to compensate healthcare professionals more, we can only spend so much. Are we spending enough on healthcare, though, in general? Well, if you listen to unions and public healthcare advocates, you think we're not. No, it sounds like we're starving them. But the budget statistics tell a different tale. Healthcare spending has been steadily increasing in every province in Canada for years. Spending spiked in the last 2 years due to the pandemic, of course. In 2021, the national per capita amount being spent on healthcare was $8,019. That's in 2021. 10 years prior to that, in 2011, it was $5,806. It's almost a 40% increase over 10 years. We can't sustain that spending trajectory. We can't pretend that we aren't spending enough on healthcare. In spending that much per capita, Canada spends more on healthcare than most countries in the developed world, yet our outcomes are lagging by just about every measure. Access is abysmal, and people are literally dying on waiting lists. Medical specialists in particular are in short supply everywhere. So if we can't spend our way out of the problem, maybe it's time we stop trying to and examine the system itself. See, there's where the problem comes in. Canada's created a mythology around its healthcare system and spent decades tirelessly telling us we have the best system on earth. The CBC dedicated an entire game show to determining who the best Canadian ever was, and it was handily won by Tommy Douglas for founding our healthcare system. Whenever anybody dares to question the system in Canada, they're labeled as a blasphemer, and horror stories of the heartless American system are sure to follow. What the stalwarts defending the status quo with Canada's healthcare system refuse to acknowledge is there's hundreds of healthcare systems on Earth, and dozens of them offer universal coverage better than we do and for less money. We can't let people keep shouting down any discussion of systemic reform if we want to see improvements. Anybody who's been in a position of employing people knows that while good compensation levels are essential in retaining good staff, the work environment itself is critical as well. If people are stressed, underappreciated, or overwhelmed, they're going to leave. And this is happening in healthcare. And since spending more money won't fix it, we need to change how we do it. It only makes sense. It's hard to say, though, how bad it's going to have to get before people are ready to pursue changes to the system. But when we double health spending, when our waiting lists truly become the longest on Earth, we're on a trajectory to meet both of those metrics right now. Sustainability is a popular buzzword these days. Well, let's apply it to our healthcare system and add a dose of reality. Our system right now is rigid, inefficient, and unsustainable, and we need to make radical changes to it. Until we do, those healthcare headlines that look the same across the country about the shortages won't be going away anytime soon.